Hello and welcome virtually to the Woodrow Wilson International Center for Scholars. My name is Christopher Sands and I'm director of the Canada Institute here at the Wilson Center, and I'm very pleased to be able to bring to you a program looking at lessons learned from the COVID pandemic for the management of borders and our Canada-US relationship. We have three fantastic panelists this morning. Let me introduce them to you very briefly. Dr. Lori Trotman is the director of the Border Policy Research Institute at Western Washington University. She engages in a range of research on the US-Canada border, particularly in the Cascadia region. Her specialty topics include trade, transportation, human mobility, and security. In addition to working with faculty and students, she collaborates with the private sector and government agencies to advance policy solutions that improve border efficiencies and strengthen the Pacific Northwest region. She's a member of a number of working groups, including the Pacific Northwest Economic Region, the International Mobility and Trade Corridor Program, the Canada-US Transportation Border Working Group, and was recently appointed to the steering committee of the Cascadia Innovation Corridor Initiative. Edward Ted Alden is the G. Robert Ross Distinguished Visiting Professor in the College of Business and Economics at Western Washington University. He's a senior fellow at the Council on Foreign Relations in Washington, D.C., and author of Failure to Adjust, How Americans Got Left Behind in the Global Economy, from Rowan and Littlefield in 2017, and The Closing of the American Border, Terrorism, Immigration, and Security Since 9/11, from HarperCollins in 2008. Ted has written widely for major newspapers, including the New York Times, Washington Post, and Wall Street Journal, and has appeared on CNN, CNBC, MSNBC, Fox News, the PBS NewsHour, and Bloomberg Surveillance, and was the Washington bureau chief for the newspaper The Financial Times from 2004 to 2006. Lori and Ted together are the authors of a new book, which we'll be talking about, on COVID and the border, When the World Closed Its Doors. Providing commentary on the presentations will be Molly O'Toole, a Pulitzer Prize-winning journalist working on The Route, a nonfiction book on global migration through the Americas for Crown Publishing, a Penguin Random House imprint, due out in 2025. She most recently was an immigration and security reporter for the Los Angeles Times, as well as a fellow at George Washington University and Cornell University. From Latin America to South Asia, Molly O'Toole has written for outlets such as Foreign Policy, The Washington Post, The Atlantic, and the Associated Press. She was awarded the first ever Pulitzer Prize for audio reporting in 2020 with This American Life. Her work has also been recognized by the Rockefeller Foundation, the Whiting Creative Nonfiction Grant, Livingston Awards, and the National Press Club, among others. She lives in Washington, D.C., but will always be a Californian, rounding out a group that are coming to you as we speak in the morning in Washington, but very, very early out on the West Coast where Ted and Lori are. So thank you all for being here. We're thinking West Coast this morning, and I'm going to turn it over to you, Lori, to start us off.
Thanks, Chris. Thanks everybody for joining us. So we were really happy to be able to pull this panel together because it's 5 years. It's the 5-year anniversary, as many of you will remember, since COVID was designated a pandemic by the World Health Organization, and also since the US closed its borders to essential travel from Mexico and Canada across its land border. That was, I think, almost exactly 5 years ago, just a few days ago. So this 5-year sort of retrospect gives us a bit of an opportunity to look back on what happened, what worked, perhaps what didn't work, and hopefully reflect on ways that we might try to pull those lessons from the past and apply them to the future. We are already facing some potential pandemic-like sort of flickerings along the edge of things. So taking a little bit of time to reflect on that moment in time, I think, is very useful, both from a policy perspective and also from sort of the lived experience of what people on the ground felt, what companies experienced, and what we might be able to do better next time. So maybe I'll set the stage very quickly and then I'll hand it back to you, Chris, just to remind people, because I think a lot of us have sort of forgotten those COVID years. As Chris mentioned, Ted and I wrote a book called When the World Closed Its Doors, the COVID-19 Tragedy and the Future of Borders. And we came across something that some other people that have been writing about this time period did as well. And that was this sort of amnesia around what happened during that time, because so much happened. It happened so quickly. And many of us moved on and would prefer not to think about that time because it wasn't exactly fun times. And particularly for people in border communities, it was even perhaps more stressful than for the general population overall. So it was like, as I mentioned, exactly 5 years ago when the US put travel restrictions on Canada and Mexico. To that point, we had restrictions from China, we had restrictions from European countries traveling here. But we decided to restrict our land border travel with Canada and Mexico. Now, an important component of this policy was it did not actually apply to air travel. It was just our land border travel. We decided to define things as essential that would be able to continue to move back and forth. That was primarily commercial cargo, but also people traveling for essential reasons. And I'm sure we'll get into sort of the nuances around what was essential and non-essential going forward. And we kept those in place for about a year and a half, depending on how you slice it. Those moved from this sort of designation of essential, non-essential to being vaccinated, but requiring a test. The US never actually required a test at the land border, but we did require a vaccination. And then Canada and Mexico sort of, and to a certain extent, did their own thing. The Canadian side, Canada also restricted their land border with the US to essential travel, but they applied that across all modes of travel. So we saw similar approaches to air travel to Canada and to land travel to Canada. Another big distinction between the Canadian border rules and the US border rules was Canada had a required mandatory 2-week quarantine for people entering Canada or returning to Canada if they were sort of non-essential travelers. And one more piece I will mention is that we operated under this sort of continual 30-day extension. So when the policy was first announced, it was for 30 days. It was a temporary measure. It was intentionally framed in that way to allow for some sort of dynamic and flexible policy adjustment. In the early days, things were very uncertain. We didn't know much about the virus. We didn't really know how it was transmitted or what the symptoms might be. So we created this 30-day cycle early on to allow the countries to adjust these restrictions. But they ended up following this 30-day extension cycle for well over a year. So I think I'll turn it back to you, Chris, as sort of a brief intro into where we were 5 years ago.
Thank you very much, Lori. Ted, let me pass it on to you. You've often been able, and I know talking to you a little bit about this book, to also bring some of the human element in. And I wonder if you could add to the presentation next.
Yeah, let me just talk about a couple of things to hopefully, set up our further discussion. One is, as you say, the human element of the story. These border restrictions had enormous human consequences. We had never seen on this sort of global scale a closing of borders to all sorts of movement. So Molly will be familiar with this from her work, but migrants who lost their jobs in a lot of countries were forced out, had to go back home. You had massive unemployment as a result of these restrictions. So people's lives were really upended. If you look at the container shipping industry throughout the pandemic, we were, here in North America, many of us, if we were lucky enough, stuck at our homes and able to work out of home, and we were ordering things that would arrive by Amazon or whatever your preferred method was. As a result, you had hundreds of thousands of container ship workers who were essentially locked on their ships. No country would let them off in order to return back home or let the next shift on. These were workers from poor countries in most cases, Indonesia, the Philippines, Russia, and others. And we tell some stories of the very high personal costs for these individuals. And there are a lot here in North America who had in different ways built their lives across borders. suddenly found those lives didn't work anymore. And we tell quite a few stories of couples married and otherwise who were separated by the border restrictions, couldn't see each other throughout the pandemic. One story we dwell on at length in the U.S.-Canada border was the McCall family, and Donna becomes sick with liver failure, and her kids in the United States, even though they're Canadian citizens by birth, are barred from coming to see her. And then at the most extreme links, we had countries like Australia and Canada, excuse me, Australia and New Zealand, which effectively rationed the return of their own citizens. They had rigid hospital quarantine requirements, not enough space to accommodate all of their own people, citizens and permanent residents who wanted to come home. And some of the more extreme stories we tell are from those countries. A couple, for instance, that went to India with their 2-year-old daughter to visit their grandparents. Um, the grandparents pleaded in sort of February of 2020, please leave the girl a little longer. We'll take care of her, and then we'll bring her back to Australia, where they had visas to visit. And the couple goes back to Australia, and Australia closes to travel from all over the world. And the little girl can't get back. They won't let the grandparents board a plane. Australian government goes so far as to suggest, well, there are some Australians and Indian who are permitted to return. Perhaps your daughter could be accompanied by one of them. And the father says, I mean, look, she's a human being. She's not a package. So she's separated from her parents for well over a year. So we tell a lot of these stories in the book. Just to sort of summarize what I think is our big takeaway from the book, what we learned from COVID is two things. Border closures are really popular. Like, the publics love them. It's one of the reasons borders stayed closed so long, even in a country like Canada that has a long history of recognizing that an open border with the United States is critical to Canada's success and survival. Border closures were extremely popular, and this was the case around the world. And the second big takeaway is, in most cases, they were not very effective. The countries that used border limitations well during the pandemic combined it with quite sophisticated public health interventions. In the United States, there's no evidence at all that the border closures were a life-saving measure. We had one of the worst records in COVID of any country in the world. In places where they probably had more impact, like these island states in the Asia Pacific, either, as I said, you had these effective public health interventions, South Korea and Taiwan are good examples, or you had really draconian border closures, which created enormous human consequences. And we can talk about it a bit more, but I think that's a lesson that very much carries over into our current moment when we have an administration in the United States that believes that closing borders and shutting off travel is the cure to all evils, from unauthorized migration to drugs to terrorism to pandemics. And I think in the context of COVID, our book shows very clearly that borders are no magic bullet, however much the public likes seeing them used in this way.
Thank you very much, Ted. That tees up perfectly a commentary from Molly O'Toole, who also has a global perspective. Molly, over to you.
Yeah, thank you. Thank you for that. I had to go back through my own stories and my own notes to sort of remind myself, because I feel like we too have this sort of COVID amnesia and the effects that it's having just on the way we think and the way we interact with each other, affects us as well. I do have a global perspective on this, both southern border and northern border and beyond. I'm a little worried you can't hear me. Do we have signs of life here? Yes. Okay. Thank you. I actually, when the United States started issuing some of its border closures, and really around the world, I actually found myself in Guatemala. I was working on my Spanish, and I was on a Spanish program, and Guatemala closed its borders completely. To the airport was shut down, etc. And we decided to stay to sort of report on what that looked like as these countries started to close their borders. And ultimately, I ended up having to come into Mexico, which ultimately didn't issue any restrictions. I had to cross the land border in a somewhat gray situation in order to get back to the United States. So I have this perspective And very interestingly, from the context of migration, which is my context, Guatemala had almost no COVID cases at that time in March of 2020. I believe that they had 6 in the first couple of weeks. The United States already had thousands. And the way that COVID really truly entered Guatemala and expanded quite dramatically was through deportation flights. And at that moment, Guatemala, it's a very small country in Central America, briefly told the United States they weren't going to accept deportation flights. And this was a huge, huge deal. And then under pressure and with certain assurances from the United States, they were sort of forced to start accepting deportation flights again. And then ultimately it was sort of discovered that the US wasn't in fact really screening for COVID. And that's one of the reasons. So I use that illustration not only for my personal experience of these COVID border closures, but to show how much, as Ted said, from a public health perspective, often these border closures were not effective. From a human cost perspective, it had an incredibly dramatic impact, particularly in Latin America, which certainly affects the US-Mexico relationship, but also on the US-Canada border, because this internationalization of migration that was already occurring in some ways was dramatically accelerated by the COVID border closures, which sounds counterintuitive, but there was a lot of mobility going on in terms of people from all around the world entering the Western Hemisphere, making their way north, with some of them not having the United States as their final destination, but in fact Canada. And then all the border closures did was sort of stop that for a period of time, sort of trap people within. And then as soon as we had those border closures lifted, we saw a really incredible, dramatic increase in terms of this international migration through the Western Hemisphere, both to the US-Mexico border and to the US-Canada border. So I'll stop there, but just to reemphasize the point that from the work that I've done on the ground over the last several years, all throughout the Western Hemisphere and even beyond, seeing the sometimes unintended consequences of COVID border closures, some of them being used to justify migration restrictions despite not being a real public health justification, have often had unintended consequences, not just for public health, but in terms of migration and absolutely economic impact.
Thank you very much, Molly. That's excellent. Let me ask a question for the panel, and this is a specifically Canada-US question, but from the very beginning of the pandemic, President Trump and then Prime Minister Justin Trudeau were seen to be coordinating, and they talked about trying to address the COVID pandemic together. And when the border was closed, it was closed to all intents and purposes, as far as the public could tell, jointly. And yet it wasn't as smooth as all that in the actual application. Can you talk a little bit about Canada-US cooperation, both what was, say, initiated versus how it played out over the next couple of years of the pandemic? And maybe I could start with you, Lori.
Yeah, thanks, Chris. Probably a good sort of broader framework to use to jump into this question is actually to look at some of the guidance from the World Health Organization, the international health regulations in particular, that kind of laid the broad policy framework for the countries that are a part of the World Health Organization, who agreed to sort of a minimal use of borders as a response to a global pandemic. And really pretty clearly in those regulations, suggest that borders can be counterproductive. They can create these unintended consequences. If we restrict travel across our borders, we create a lot of harm. And there's also sort of questionable benefits around the use of those. We saw similar policy framework with the European Commission early on. And then here in North America, we had the North American Plan for Pandemic and Avian Influenza, which essentially said the same thing. Like, there is a role for borders, there's perhaps screening at airports, but particularly when it comes to the land border and the very, very long land border that the United States has with Canada, but also with Mexico, border controls and border restrictions are certainly sort of not the ideal policy tool to use in regards to a pandemic. And they can also cause governments to sort of withhold information, which can inhibit the cooperation, the collaboration that's needed on the exchange of health information. So in terms of the U.S. and Canada, I think you might have been involved sort of some of the higher levels, but there was this very quick and hectic scramble by the U.S. and Canada to figure out what are we going to do, what are we going to sort of agree to, what are we going to continue to keep moving. And I think one clear example of some good collaboration that happened at that time was the ability to keep commercial goods and essential travel continuing to flow. I mean, that was very quickly decided. I think it was sort of a week or a week and a half's time period. And kudos to the people that were involved in that negotiation because it was no small feat. But I looked at these a lot and I lived them and I studied them intensely. And in my perspective, that was kind of the extent of the real collaboration we had involved in that policy, other than sort of agreeing to continue to extend these every 30 days. We had some pretty big sort of gaps in the way we applied these policies. The United States listed these in our Federal Register and more or less didn't really modify them at all throughout the pandemic. There was one or two short modifications. I can't remember the number off the top of my head, but I think Canada used perhaps over 50 orders in council. They approached these policies in a very different way, from much more of a public health sort of standpoint. So there was a lot of tweaking. There was a lot of changes that happened on the Canadian side, whereas the US, we sort of set it and forget it for the most part. And then as these restrictions started to evolve, we saw even less and less collaboration and alignment between the US and Canada. The testing requirements that we did have in place, again, we didn't apply them equally to modes of travel. Canada required a test at the land border. The United States did not. Canada required a PCR test. The US required antigen tests. We had different testing windows. We also didn't even accept the same list of vaccinations. I actually had a Mexican colleague fly up here to visit some point pretty late in the pandemic, and she had her vaccination, and she said, well, I'm going to go to Canada and continue my research. And she got turned around at the border because the Chinese vaccine that she had was not accepted by Canada. And she said, I just figured two countries like Canada and the United States would be enough on the same sort of footing that you'd be recognizing the same vaccinations. And I said, well, I would think so as well. So there was a lot of discrepancies and a lot of differences. And of course, the main one being that, as we were all poised to see what would happen in June of 2021, would we open, would we not? Canada moved forward on opening the restrictions, loosening them up to vaccinated travelers, and the United States did not follow suit for another 4 or 5 months. So we really sort of we were aligned early on, but that sort of seemed to unravel quite quickly. And I think that's because Canada and the US approached these from a very different perspective. And I'll just say one more thing. And I think maybe getting back to these sort of on the ground impacts and unintended consequences for people living in borderland communities, having these different standards and these different requirements was incredibly confusing, because not only did you have to figure out what you needed in one direction, which might be very costly, with testing and vaccination, et cetera, for an entire family, but you had to figure out what you needed to go in the other direction as well. And so many people were confused. Many people didn't understand, if these policies are supposed to be rooted in sort of science and public health expertise, how is it that they could be so fundamentally different? So that caused a huge disruption, and just that lack of sort of predictability and certainty around what might happen from month to month was incredibly harmful. Again, not just for sort of families and loved ones, but for businesses as well, who couldn't really plan forward as to when they might actually be able to cross the border and visit a manufacturing site before they could sign a contract, for example.
Thanks, Lori. Ted, nobody likes a Monday morning quarterback, except we've all been there. And looking back, I wonder if you could talk a little bit about not just some of the things that didn't work, but maybe some highlights of things where maybe it's an individual border officer or someone, had a heads up play where they actually did all right. And I have to ask you too about one thing Canadians still talk about, which is the Arrive Can app, and whether technology could have played a better role or did actually maybe play a better role than some of us thought.
Yeah, I mean, Lori is probably better to go into some of these details than I am, and as you both know, I'm not the one to look to for an optimistic take. So I will. I actually quite liked ArriveCan, but part of why I liked ArriveCan is that my university covered all the testing costs for me, so I would go get tested and enter the details into ArriveCan. It was easy. It was relatively easy for me. I went as soon as the border opened, because my mother was there, our daughter was at school at the University of British Columbia in Vancouver, son was up there, sister was up there. I crossed a lot, and I actually found the ArriveCan system relatively easy to use, but that was not the universal experience at all. And there was a lot of controversy in Canada, both over the cost of the system and the difficulty in using it. I'm going to take the question in a slightly different direction just to highlight one other point that I think is really important. You mentioned the first book I wrote, which was about borders after 9/11. And one of the chapters in that book is largely about US-Canada cooperation at the border after 9/11, which was incredibly far-reaching, incredibly significant. The Smart Border Declaration and the various specifics that followed. I mean, just background, there was fear in the United States at the time that the Canadian system in terms of entering, allowing people from overseas was weak, that it would allow terrorists to enter. We know that none of the 9/11 terrorists came via Canada, but the so-called Millennium bomber Ahmed Rassam, who was stopped out here on the west coast at Port Angeles, was, from Morocco, came in as an asylum seeker to Canada and plotted an attack that didn't turn out to succeed. So there were reasons for the US to be concerned. And basically, the Canadians and the Americans responded with the most in-depth set of negotiations on how to build collaboration across the border to try to strengthen protection against terrorism while not interfering with lawful trade and travel. Indeed, the goal was, if possible, to improve that. I mean, the information systems with respect to cross-border commercial transport in particular improved radically. All of that was such an enormous contrast to what Lori is describing from the COVID period, and where the cooperation such as it existed was extremely lackluster. And I think it tells us something about the current moment that we are in. I think I really strongly believe the Canadians made a mistake during COVID. I think they forgot how important it was to maintain collaboration and to maintain as much as reasonably possible an open border. But the fears about irresponsibility here in the United States, this was the first Trump administration. We had a very chaotic response. Canadians were worried about their healthcare system, and they basically said, let's just shut them out. And you can understand the short-term impulse for that. Long-term, I think it was a big mistake, because I think Canada depends very deeply on a collaborative arrangement at that border that works. And unfortunately, I think a lot of the progress that was made after 9/11 is at the best moribund. Um,
Fair enough. Lori, can I, Ted teed you up to talk a little bit about ArriveCan. Can I come to you on that?
Yes, I'm happy to. I think ArriveCan was a really interesting experiment, and maybe I'll start by telling my own experience with ArriveCan, which there's this little town out here called Point Roberts, which has garnered a massive amount of media attention, particularly during COVID. It's essentially a little blip of US land that is attached to Canada. It's home to about 1,000 Canadians and Americans. But anybody who lives in Point Roberts, Washington, has to drive about 20 miles or so through Canada to get to the United States. So they have to cross two international borders to get sort of back to their own country. So you could imagine how complicated that was for people living in Point Roberts during the pandemic, because they had to cross into Canada, into the United States, and then do the reverse. So when ArriveCan was introduced, there was a couple things that played out in Point Roberts that I think speak to the broader issues around it. One is that there was no way for people who might be, for example, making a day trip into British Columbia or driving through British Columbia, to avoid answering the question of where will you quarantine if you come down with COVID. So if you are living in a border community and you're making a day trip across the border, you essentially had to lie on your ArriveCan submission. And I was somebody who who was traveling to Point Roberts one day, and I got to the border and I told the Canadian officer, look, I just put it in a hotel location because I have no, like, I would go home if I came down with any symptoms in the next 2 hours. And she said, oh, yeah, that's what we're telling people to do. So the system was sort of set up with the wrong parameters to begin with, which is concerning to somebody who does not want to present false information at the border, right? Another one is it was very glitchy. So again, I found myself out in Point Roberts, which is a rural community. The internet isn't great, and I was unable to submit one of my ArriveCAN trip manifests because I didn't have enough internet connection. So I was essentially trapped. Luckily, I found the library, and the wonderful librarians there helped me. But that's all to say that even if you are somebody such as myself who studies this for a living, who crosses the border often, it was confusing and it was difficult to navigate. That said, it was really kind of a genius tool because never before at the land border between the US and Canada had we had a way to collect information from travelers who were arriving at the land border. And that's always the challenge with the land border is you don't know who is arriving until they arrive. So this was a tool that many of us who study border policy really saw as a great development and incredibly useful potentially for other things in the future. You can collect travel information in advance. You can sort of pre-vet your travelers. There's even in some ports of entry kind of an ArriveCAN ready lane, more or less. So if you knew you had everything squared away, you could move through the system a little bit quicker. So I think in some ways it was successful from a proof of concept standpoint. As Ted mentioned, there was obviously a lot of politics and a lot of issues around the cost of it. But I think my biggest sort of criticism is that it was disconnected from the reality on the ground. And there were some people who couldn't use ArriveCAN because it didn't fit their situation. And there's also a lot of people who still don't have smartphones. My father-in-law is one of them. So it was set up for people who are somewhat digitally savvy. I mean, you could do it on the internet as well. But if you were somebody who didn't have a good internet or you weren't tech savvy, you were sort of left out of that requirement, and it was required before you could cross the border. So it created a little bit of this digital divide that we have spoken about, which made it harder for people to cross, even if they were trying to follow all the rules.
Thanks very much, Lori. And I want to emphasize for anyone who's watching it, the situation you were describing in which you talked to an officer about, the fact that at the border you were going to hopefully make it home and so on and so forth. You weren't lying to the government. You were simply trying to talk to somebody about how the box didn't work in ArriveCAN, which I completely understand. I don't want anyone getting the impression that that's something we would recommend. Molly, I want to come to you next. And I thought Ted raised a very interesting comparison and Lori spoke to it too, which is between the two sort of great international travel and border upheavals of certainly my lifetime, the first being 9/11 and the second being COVID. You've covered the situation around the world. How would you characterize how governments responded to the two? And do you share the view that, in some ways we were more successful in addressing terrorism than a pandemic?
Well, that's a heck of a question. I'll try and engage with that. Ted wrote a whole book about the sort of post 9/11 border infrastructure, and so he could probably speak more deeply. But I do think it's really interesting that an often overlooked moment is that Vicente Fox had actually come to Washington, D.C. And was meeting in the White House, and they were discussing and really actually, dotting their I's, crossing their T's on what could have been a sort of really since the Reagan era, a massive quote unquote amnesty, but a sort of forgiveness, a way for people to regularize their status, and that was in its final negotiations when 9/11 happened, and I think that's a really interesting sort of anecdote there. And even in the context of 9/11, the border was closed. Land ports of entry were closed, but not for very long, in fact. And it was very clear even from the beginning, as they talked about security concerns. People were terrified really after 9/11 and sort of scrambling, that especially from the business community, of course, which President Bush had very close ties with in Texas, especially. The business community was advocating very strongly for, let's reopen. This will also be sort of a sign of our economic resilience, our cooperation, that we can do both security and, sort of maintain economic flows, especially over the Mexico-US border. So it's an interesting case to look at, but in fact, the border wasn't in fact closed for very long under 9/11 when this dramatic thing had happened. And the other thing I want to note is there has been somewhat of a tendency to overstate the risk of terrorist groups seeking to take advantage of and infiltrate migration flows over both the US-Canada border, but in particular over the US-Mexico border. It's sort of remarkably, statistically, it would just seem that it would be more likely, but there has not been a case of someone illegally crossing the US-Mexico border in order to commit a terrorist attack and then going on to commit an attack on US soil. So it has been somewhat overstated because there's an attempt to conflate, I think, border security, migration, national security. So in the COVID context, we saw Title 42 invoked. And this is a sort of obscure public health law that was used to shut the border, but selectively to asylum seekers. Trade continued in a significant way. It was exclusive to people who were coming to ports of entry in order to seek access to asylum. And so it was used with a public health justification. There was a CDC order, but we have had reporting since that indicated two important things. One, that one key White House advisor, Stephen Miller, had been seeking a sort of public health justification to try and shut down certain types of migration at the border for some time, even prior to the emergence of COVID, based on some of these public health laws that might give you a broader authority to do so. And then the second aspect of that being that I wanted to highlight that I am now blanking on. Title 42 is the most significant measure that had been put into place at the border. Millions of people were expelled without access to the asylum process, which the United States is legally obligated to give access to under both international obligations and domestic obligations. And it was kept in place by both the Trump administration and the Biden administration. And reporting since has indicated, even from the CDC, that they were incredibly wary about invoking this from a public health standpoint and essentially saying there was no public health justification. And the concern being that this could undermine institutes of public health, who, as Lori noted, if the basis is supposed to be sort of scientific, objective, sort of knowledge, then not only should there not be these variables between countries and should there be more coordination, but the concern was that it would undermine public trust in public health institutions of science, institutions of research. And I think we have seen that play out somewhat. So there are interesting differences. We may have talked in the language of security to some extent around some of our migration measures, but despite the dramatic situation with both post 9/11 and with COVID, actually many of the measures taken in COVID went much farther and were in place much longer than under 9/11, although obviously 9/11 has defined so much of our policy, our politics, and the way we travel. In terms of border closures itself, it was more significant really under COVID-19. Maybe Ted will correct me on something.
Chris, just a two-finger on Molly's excellent point about the CDC. CDC wasn't just wary. The director of global migration and quarantine, Dr. Martin Cetron, who we did a series of interviews with for the final chapter of our book, he was the gentleman in charge of the U.S. response to SARS in the early 2000s, of the response to Ebola, which was very controversial in this country in 2015, 2016. Donald Trump at the time was calling for a complete closure of the United States to Africa to respond to the Ebola outbreak. Dr. Cetron oversaw a much more targeted airport screening, both in the departing airports in Africa and here in the United States. He refused to sign Title 42. He said there is simply no public health justification for concentrating on asylum seekers at the southern border. He was the one who was supposed to have signed it. It got kicked up to his boss, Robert Redfield, and it went ahead. But I mean, Molly described it perfectly. I just wanted to emphasize CDC wasn't wary. The gentleman in charge of this entire file for a quarter century in the CDC was strongly opposed to the use of Title 42.
Thank you for that, Ted. That's actually very, very useful to get the detail that you had from the book. I'm going to come back, though, to Molly on something that sort of a memory. I remember before 9/11 having a conversation with my mother, who's wonderful. I won't hear otherwise. But we were talking about shark attacks off Florida. And my mother doesn't live in Florida, but there was a sort of spike in the number of sharks that were biting people. And I sometimes find, and both you and Ted have a media background, so this is not meant to be a criticism, but I do feel like sometimes we have a funny sense of risk, and it comes from just a general desire to be secure, but also because a lot of what we read out there, coming to us as news, actually emphasizes risk and makes you think, oh gosh, what's the latest thing I need to worry about? And so can you talk a little bit about that dynamic and how it affects migration, and including the migrants themselves and the officers who have to work with them, this sense of anxiety, fear, of the unknown, of what peril might be there? Because as you were talking about 9/11 and but also about COVID, that element did seem to be a consistent theme and maybe a driver of policy decisions as well as individual interactions.
Absolutely. And I will be as critical as a member of the media, but I will be as critical as anyone in how we sometimes contribute in very negative ways when it comes to public education and just delivering really important news. In that we sometimes we sometimes exaggerate by our sort of selection bias on what we report on. As you said, you'll often hear sort of the worst case scenario or see, and we don't often right size. And that in giving that context. Now, it's a little bit of a chicken and egg question, which we don't have time for today in terms of, are we giving the people what they want, or, I mean, we can get into that, but certainly, I mean, look, let's take the case of Title 42, this idea of sort of fear of the other and disease, sort of disease carrying migrants, disease carrying foreigners, whether they pose a security risk in terms of danger or sort of a health risk. This unfortunately plays on some of the most classic tropes. And I'll focus on the United States in terms of American politics. We've seen some of that language that was behind some of the strongest immigration restrictions on the books in the United States, such as the essentially race-based and nationality-based quotas that we saw in the 1920s. So that's sort of a classic trope. But I absolutely think that to some extent, this conflation of danger, of migration, of border security, national security, public health, really that we saw around COVID-19 is sort of the progression of how this conflation has infected, there's a better word to use there, our politics and our policy in particular since post 9/11. A lot of the conflation of border security and national security that happened. I mean, we had the Department of Homeland Security, a behemoth monster of a government agency, second only to the Pentagon, was created in the wake of 9/11, and talk about some unintended consequences there. It's really when, despite the fact that none of the 9/11 hijackers had used the U.S.-Mexico border, one I believe had entered on a visa from the U.S.-Mexico border, but they had visas. And so despite the fact that the border actually didn't play, the U.S.-Mexico border didn't play too significant of a role, in fact, in 9/11 and what some of the security lapses may have been there, it absolutely has sort of infiltrated politics and policy since then. So I do think with COVID-19, in the fear, I mean, we were sanitizing takeout boxes. I mean, we had no idea necessarily at the beginning how it was transmitted, just speaking from a US context. So this sort of fear of the other I think to some extent primed a US public for being willing to somewhat to accept measures that were sort of blanketed in public health, but were really targeted toward an idea of course, this disease must come from the outside. And if we just seek to seal ourselves off from the world, then we'll be fine. And obviously, we know that that was not true. And to a large extent, particularly in the Latin American context, it was, in fact, the United States that was responsible for a lot of the spread of COVID-19 throughout Latin America. And in fact, some of the policies that were being used to move people around, for example, from different detention centers during COVID-19, that actually, in fact, additionally helped spread COVID throughout the United States. So there, I think you're right, necessarily a more optimistic note on how you can sort of try and right-size and cut through that rhetoric in order to really get to the heart of what might be more effective policy solutions and how to have a more rational conversation about, okay, what is the risk and how much is the American taxpayer willing to dedicate toward that very minimal risk? It's difficult to have that sort of rational conversation, given that these are very powerful, unfortunately, very powerful tropes as politics of fear and politics of the other.
Thanks very much, Molly. And I will defend my mother. She worries about things, including me, and there's an element of the unknown and fear that is more than a trope. It's actually people being scared of not knowing what's coming next. And I think that for a lot of people that's real. And but I would also say for Department of Homeland Security, it is a very big department, but I would say not monsters. Most of them are good people trying to do their job as well. And in that vein, yes, in that vein, I'll also say that the difference between what journalists do and academics do is that, nobody reads our stuff. So I'm not picking on journalism. It's just, you're so popular. Ugh. Anyway, with that, let me come back to Lori and Ted. I wanted to talk a little bit about planning. And Ted, you had mentioned, I think actually both of you talked a little bit about the North American pandemic, plant animal pandemic influenza plans. And the governments did have a plan put together after SARS. They've been talking about within the region how we could do better. We had in the Biden administration a review, particularly related to COVID, that set up a series of processes, as the Canadians say, for how we would coordinate in the event of a future pandemic. Can you talk a little bit about that? I know you opened by saying nobody really wants to talk about COVID, but at the professional level, in terms of coming up with a plan for next time, and we don't know if there will be one, have we developed a mechanism with the flexibility that we ideally want that will help us be better in the future? And I don't know which one of you wants to jump in first, but trying to get it at that, at where we are in terms of that future planning, lessons learned, if any.
Can I,
Lori,
Lori, why don't you focus on North America? Let me just talk slightly more broadly about the world really quickly, and then I'll turn over to Lori to answer your question. But the final line in our book from Dr. Cetron is he thinks we are much less well prepared for the next pandemic than we were for this one. And you can see it around the world. I mean, the breakdown of cooperation globally, really starting in China and China's failure to be transparent about what was going on, has had these knock-on effects. So I think we're actually, in terms of cooperative responses globally, in a much weaker position than we were prior to COVID, which is not a great place to be. And then I'll let Lori go into more detail on North America.
I mean, I was just going to sort of jump in and point out that we didn't do a huge COVID lessons learned commission report in the United States like we did after 9/11. I'm sure there's been things done at certain levels of government, but not a publicly available document. And to my knowledge, not sort of a widely sort of stakeholder involvement retrospective analysis, I think, which is part of the reason why it's an opportunity to talk about these things today, but a very large missed opportunity, because I don't think we have a good handle on what we would like to do next time, because I don't think we've learned from what went wrong the last time. So, more conversations are needed, but is the capacity there to have them? Certainly not right now. I don't think it was even in the years following COVID. There was just sort of one crisis to another. So I I don't think we have a great mechanism set up, and I don't think that we've learned enough from what happened during the pandemic in the North American context to be able to inform those conversations to the extent that we should.
That is teeing us up, and as we enter our last round, I guess I'm going to ask you if each of you could, with your crystal ball, your best forecasting, if you could make one, maybe two, recommendations for the future for how we ought to think differently about borders and, let's just say, public health, primarily. What should we be thinking about between now and the next time we need to know? I mean, obviously, you're right, Lori, there hasn't been a proper review of the lessons learned, but as we go forward, what's your takeaway? What kind of recommendation would you have for people looking at this in the future? And even if it's just on a research agenda, that maybe the next person ought to sit down and dig out and look at numbers or data for that question that we don't know the answer to, but we really should be thinking about now. Since I just heard from you, Lori, I'm going to maybe go to Ted first, then you, and then back to Molly.
Yeah, thanks, Chris. No, it's a great question. My big hope, and at the moment, the world is going in the other direction. So I can't say I hold out a lot of hope for this hope. But my big hope is that we can begin to move back in the direction of intelligent risk management. Your mother may be scared of shark attacks, but one of the jobs of government officials is to make reasonable judgments about risk and the costs of interventions. And we have gotten, I'm afraid, so far away from that. There was, in the aftermath of 9/11, I think, a lot of really serious work done. And to reiterate, a lot of this done in the Department of Homeland Security. Still are very serious people there who were trying to make intelligent assessments about the risks of terrorism and other things and design policies that were an appropriate response. We've just really, really lost our direction on all of this, and not just here in the United States. I mean, very much around the world. I think, countries that we would think of as more liberal, like New Zealand and Canada, I think also ended up reinforcing the notion that massive border closures are a reasonable public policy response to an external threat. And they're not. I mean, borders can play a role. They have played a role. They will play a role. But, we're living through a moment right now where the United States is threatening tariffs on Canada and Mexico unless fentanyl shipments across the border get stopped. Well, there's not a single case in modern history where border measures have succeeded appreciably in reducing drug risk. In fact, what we saw during COVID was the explosion of fentanyl overdoses because it was harder to get stuff through the border. There were fewer shipments, and fentanyl is much smaller and easier to smuggle than bulkier drugs. So the border closure in COVID actually worsened the fentanyl problem. So my hope is that we can move back in the direction of more sensible risk analysis, as opposed to this fantasy that we're going to use borders to seal ourselves off from all the evils of the world. It won't happen. And in the effort to do so, and we're living through this right now, and I think it's unfortunately going to get worse, the effort to do so will harm thousands, probably millions of people in the process of trying to carry out what is really a fantastical agenda of, let's just seal ourselves off from the world and we'll be safe. That's my hope.
Well, that's a hopeful hope. Thanks, Ted. Over to you, Lori.
Yeah, I mean, I couldn't agree more that borders are an incredibly limited tool, and they're really not the place to control a public health outbreak when you already have, public health concerns and a virus spreading within the country domestically. Maybe I'll just be a little bit more sort of policy targeted and highlight some of the things that didn't work that we could do better next time, particularly since I think it is very likely that we are going to see borders as the place where a lot of these reactions occur, whether it's a public health outbreak or, it's a terrorist attack or it's some other sort of situations. Borders are front and center across political parties as a popular tool to use in response, to some of the things Molly talked about, people people are scared. They want to pull up the drawbridges. So one, major shortfall in the last pandemic was just that lack of communication from government to the people on the ground. It was very difficult to figure out what was going on, what people were thinking, because there was never actually any metrics around a lot of these policies, these 30-day extensions. There wasn't sort of a if this, then that. It was just sort of behind a black box. So that really eroded a lot of people's trust in government. And we've spoken to a number of people who feel that their governments really let them down, not because they closed the borders in the way that they did to non-essential travel, but because there was really no communication or sort of explanation involved. So that was a really critical component. And that's where perhaps the media could help as well with just better channels of communication. And that's not just with the public, but I think with multiple scales of government as well. I mean, we had really, really engaged political leaders. I'll just speak to the northern border because that's my expertise, all along our northern border states. And they knew what was happening on the ground, and they should have been more involved in these conversations and in this decision-making process as really this multi-layer approach to government and governance that could avoid things that were happening. For example, with ArriveCan, where people didn't know where to put certain information because the fields didn't apply to their situations. And I think, maybe again, just sort of highlighting that we can learn a lot from what we saw as the unintended consequences during the actions that were taken during COVID. And I would argue potentially even now we're seeing situations where there's, conflict between two countries or various scenarios, but it's the border communities that are in that connective space between countries that can really take the brunt of some of these situations. And so during COVID, there was some efforts, particularly at the state level, to have, for example, where I live, the Department of Commerce put in sort of border relief packages, things to recognize that these border communities suffer disproportionately during these times when the borders are used as a policy response.
Excellent, Lori. Thanks very much. And now over to you, Molly.
It's very difficult to follow Lori and Ted on this, who I feel like took all the good answers in terms of recommendations. I mean, it is quite difficult. I think to both Ted and Lori's point, to the extent, and maybe this is a naive wish, but to the extent to which we can try and protect our institutions, and in particular our public health institutions, but also our security institutions, to the extent that we can try and protect them from political influence, which is very difficult to do. But I believe that certain steps could be taken to better protect our institutions from the politics of the moment. And on that note, I just want to make a brief apologies to your mother. No, of course, I was not suggesting that people's fears are illegitimate. I was speaking more to, I believe, the politicians and some policymakers who at times seek to take advantage of particular moments and can exploit people's fears. And what that does is, I think that prevents us from having that kind of rational conversation that we've all talked about as being a way forward. And to really emphasize what Lori had said about why not, what are the metrics? What are the metrics for success, both in terms of a public health context and a security context? We very rarely talk about metrics. Metrics for success. How do we measure that this policy is being effective? This policy is actually having the results that it is stated to match its stated intent. And I do think a key part of that is transparency. I think the media can help with this as well. But I think there's also part of this erosion in public trust in institutions across the board, including the media as an institution, has been a lack of transparency, letting the public in. And I think that's really key. So metrics and transparency, I think, will help protect our institutions from undue political influence that isn't serving the public or public health or public security. I think simply operating from the standpoint of acknowledging that you cannot seal off the United States. You cannot seal off the United States. You can't seal off the US-Mexico border. You can't seal off the US-Mexico border. And that is not me saying that we need to have open borders by any means, but let's operate from the reality that you cannot seal off the border. And we operate from that reality, then we go from there. But a policy of denial is simply not going to be effective, and you'll continue to throw billions of dollars at an unachievable goal. I think one perhaps silver lining in the failures of cooperation between the United States, Mexico, and Canada in the COVID-19 context, I think maybe a silver lining is we can take away how important cooperation and that relationship is between those three partners. We saw the consequences of an inconsistent, I'll just say, cooperation between the three in a public health context. And so right now doesn't seem like the moment to emphasize how important that cooperation is between the three. But I think it sort of threw into relief just how important that cooperation and that coordination is. And so I think there's a broader recognition perhaps of really how important those relationships are. And so that'll be my counterintuitive silver lining to take away from the COVID border closures.
Thanks very much, Molly. And don't worry, my mom was worried about shark attacks, but she lives in Michigan and there are no sharks in the Great Lakes. So, some fears are justified and sometimes maybe not so much, but sorry, Mom, you're the best. What I wanted to do now is thank each and every one of you. This has been a fantastic discussion about so much of what we should be talking about, but often we don't talk about, which are the lessons learned from the COVID pandemic. Ted Alden, Lori Trotman, Molly O'Toole, thank you for being with us. And for those of you viewers who are curious about Ted and Lori's new book, the title is When the World Closed Its Doors, the COVID-19 Tragedy and the Future of Borders, available from Oxford University Press, came out in January of 2025. So still in hardcover, but I'm hopeful that a paperback edition is available, and it may be also orderable from a library near you. Thank you very much for joining us here at the Woodrow Wilson International Center for Scholars, and we hope to see you again here soon.